Hi, good afternoon. I'm Valerie and I am a mammographer with South Central Foundation at the Valley Native Primary Care Clinic. Today I'm going to speak with you a little about improving breast cancer and breast cancer screening rates within the Native community and what that can mean for South Central Foundation. This is an issue that's near and dear to me, mostly because I've only ever been a mammographer in tribal communities and within tribal systems. I've never actually been in any sort of other entities. So I've only seen this and I like it, and I'll show you what I know. So what I know is that many Alaska Native women have very few resources for health care, and that includes clinical breast exams and mammograms. Oftentimes they will have little or no access to these resources. Often a sub-regional clinic for rural women is too far away, or a trip to Anchorage is too costly. Presently, South Central Foundation built Benton, Utah, which is the Valley Native Primary Care Clinic. It's a brand new clinic. We also implemented full field digital mammography about a year and a half ago. It's our plan at South Central Foundation to expand breast health services and to reach out to our customer owners and to get them healthier and screened, and to increase screening rates for Alaska Natives. So the big challenge is for South Central Foundation to figure out how to adapt traditional lifestyles and how we can incorporate that in with our health care, which is really cutting edge and very modern. So how do we bridge the gap between the two? And the plan is to create a complete new approach to breast health. And the plan is to bridge culture with modern medicine and to incorporate and respect traditional lifestyles. So what are the hurdles we have? We know that we have trouble with the conventional screening methods with Alaska Native women. It reflects in some of our screening rates. Firstly, we have to realize that we have a subsistence lifestyle that many of our customer owners still have. Women living in either remote areas or even in the greater Anchorage area, like the Matsu or Cantwell, more far-flung areas, typically rely on a subsistence lifestyle. And what that can mean is that seasonally that they will be busy catching fish, cleaning fish, processing fish in the summer, later in the summer picking berries, and that even in the winter they can be cleaning or preparing for a big moose kill. It's also important to remember that a lot of our women are remote or nearly remote, which means that they live hours and hours out of the way, and that many of them are completely and totally remote, meaning that they need either a bush plane or a chartered plane or a snow machine or boat to get to a sub-regional or even to a hub town to where they can get on a plane to be on their way to Anchorage. And it's important to remember that subsistence always takes precedence in the Native community, almost always, because if you can't feed yourself and you can't feed your family, what difference does it make if you can't survive? We have to remember Alaska Native people rely on these staples and they live off of these staples year round. So, the logistics. This is the mammography units or facilities available to the public of Alaska. There are 31 in all, 8 of which are tribal and 2 are military. So it kind of looks like Alaska has chicken pox. And then you'll notice these are the tribal mammography facilities. And what you can't see here is that in areas, especially like over here in Bethel and in Nome and even Fairbanks and Barrow, is that many women come from villages and all these surrounding areas, and they have to come in to a hub site just for basic services. So what limits the access for our women? So when a woman comes into Anchorage and she has a clinical breast exam, she's unable to get her mammogram that same day. She actually has to wait not only 14 days, not 28 days, but 81 days total. That's how far our backlog is. So another hurdle we have is the misinformation and statistics regarding breast screening with Alaska Native women. And in part, that's because, quite frankly, we're still fairly new state, and the tribal health system has really grown up in the past couple of years, and we provide a lot of the data and statistical information for our areas. So we're still really in our infancy. So when the CDC does screening, these are the screening rates for 2010, you'll notice that Alaska Natives and American Indians are combined in one statistic, which means that Alaska Natives are combined with the rest of the entire lower 48, which I don't feel is accurate in combining screening rates, particularly because of the limitations that we have for screening. So you'll notice that Black and African American women are at 73.2%, white women are at 72.8%. The lowest are Asian Americans at 64.1%, and Alaska Natives and American Indians are 69.4%, and that's women between 50 and 74, and that is having a mammogram within the past 2 years. But like I said, remember, it's important to remember that these are combined statistics. So this includes reservations all over the United States. But what I do know a little bit better are South Central Foundation's HEDIS scores. And the HEDIS score is a benchmark that we use to compare as a quality assurance tool with the rest of the nation. And in our HEDIS scores, you'll notice we've kind of got some changes going on here. So this is 2013, and coming all the way to our little pilot program here that we've just begun in 2014. And you'll notice that the HEDIS score goal for South Central Foundation and the Alaska Native Medical Center Network combined is 57.85. Starting in March 2013, we were at 45.3. You'll kind of notice with this little pattern that we've come along the bottom, we've moved up and up and up. What this graph doesn't tell you is that in March of 2013, we opened the Valley Native Primary Care Clinic. So some of that 81-day backlog was relieved with our women who go to the Wasilla Clinic now. So now you'll notice we're climbing. And you'll notice here the 2014 pilot program, well, between December 2013, we were at 48.5. After the pilot program, we're at 51.3. And so I'm talking about this pilot program. We'll get to that a little bit later. So what statistics don't reflect for Alaska Native women and American Indian women is that breast cancer is the #2 cause of death, and that is in part because typically our women are so late to care and typically have their mammography screenings, their first mammogram, later in life. American Indian and Alaska Native women also have the lowest 5-year survival rate of any woman with breast cancer of any ethnicity in the United States. These two here are a little bit different than the other two, and it has a little to do with our backlog. This is a 24% marker and a 15% marker. This represents the do not keep appointment rate, so women who don't show up for their appointments. In the Valley Clinic, that's at 24%, and in Anchorage, it's 15%. So how do we bridge the gap? How do we account for our women with traditional lifestyles, and how are we going to make healthcare better for them? And the way that we figured we'll have to do that is by reaching out with a completely new approach, because what we're doing isn't working and it's not cost effective, and we're not getting everyone screened. So there's a few things that we've started, and this is the same-day mammograms. This is the pilot project I was talking about. This is women who want to walk in. They've already had their well woman exam. They have a clinical breast exam that's asymptomatic. So if you walk into the clinic in Wasilla, you can walk in Monday through Friday, 8 to 5, and if there's availability, they will get you in, which is B. Otherwise, if a woman comes in for her well woman annual, she is able to schedule her mammogram the same day, and unless anything is otherwise out of whack, then she's able to come to Wasilla. In Anchorage, we do expect for them to be a little bit busier and oftentimes a little more booked, mostly because it's a bigger hub town. We have people that fly in and out all over Alaska through Anchorage. But we have cleared the schedule with a time slot from 2 to 3 p.m. where women can walk in and have their mammogram if they have a good clinical breast exam. And I should mention that clinical breast exams are valid for 1 year. So the 81-day backlog doesn't exist anymore. We've only been trying it for a few weeks, and we already have women who can come in same day and get their mammogram. So one of the ways that we are trying to bridge this gap and to lessen quite frankly, the limitations that we have for women in breast health is by doing village outreach. So far, the Valley Native Primary Care Clinic has partnered with several sub-regional clinics, one out of Iliamna and one out of McGrath. We've done several seasonal village trips, meaning that we have gone out during months when people are not busy with their subsistence lifestyle, when they're more available and when they have the time to come. We have a mid-level provider go out, do the clinical breast exam. Then the women come to the valley on a chartered airplane that is paid for with grants, Avon and CDDC, and they have their mammograms at the Valley Native Primary Care Clinic. Education and prevention is clearly a part of the program also. When the mid-level providers go out to the villages to perform the clinical breast exams, it's my hope that they convey several of these points that are really important, I think, for Native culture and in understanding Native culture. Because if you don't understand what your customer owners are like or what their life's like, how can you help them better help themselves? So it's really important that we learn to adopt our roots for Alaska Native women, and it's important that we take back breastfeeding and readopt lactation education and really tell them how important that is for their babies and for their breast health. It's also really important that we show women how to do self-exams and to remind them to do it. This is a picture of a steam bath. It is in part because I've had a lot of women come in and tell me, I never noticed something, but my sister did right here when we were in the steam together. And in a lot of villages where they don't have running water, that's where this will happen. So it's important for women to know, like, hey, your auntie's doing it, your mom's doing it, everybody's doing it. Let's do a self-exam. Maybe they'll notice. And then it's really important that the mid-level that goes out to the village reaches out and lets these women know how important it is for regular clinical breast exams and for regular mammograms. 18.3% of Alaska Native and American Indian women in 2010 had irregular or only one mammogram ever. That was in women 40 and older. So what do we know in summation of everything I've told you? We know that conventional screening doesn't work. We can't expect our women to come to us every year on the mark. We know that the statistics are not representative of who we really are and who we serve. And lastly, we know that we're going to have to reach out for these women to be able to come to us and to be able to live happier lifestyles. We have to reach out to their lifestyle and help them into our world and let them know that they're well and embraced. And lastly, this is one of my favorite quotes. It's from an Alutiiq woman, Nina Olsen. We are strong and we are survivors. And although I don't know any Alutiiq, Koyana, that's thank you in Yupik. Any questions?
Yes. How are the mammograms paid for in the Native community?
So within the Alaska Native tribal health system, there are several different ways that mammograms are paid for. Often, a lot of our, they're called customer owners, we don't call them patients. Customer owners are on Medicare, Medicaid, and typically they'll use those programs. Also, people bring private insurance to us, but needless to say, Indian Health Services covers the remainder of the portion of their bill. So whether you carry Medicare, Medicaid, or private insurance, or you come in on a grant, none of these customer owners will ever see a bill.
Do you think having them being able to fly in on a grant entices them to come in for their exams? That way they can come to town for other needs as well?
Absolutely. And if that works, I'm all for it. If they're going to come to Costco, may as well have a mammogram.
And do you have any idea how many women go outside of ANMC, for their mammograms, other than Indian Health Services?
It's a great question. I truthfully don't. I know that will be something that is available on the CDC. I have looked at it before. I don't know it off the top of my head. But I do know that there are over 10,000 Alaska Natives in the Mat-Su Valley and that we serviced almost 1,000 of them last year. So, and that was starting in March. So we're certainly getting there, that's for sure. But I'll have to get back to you on that. Good question.
Thank you.
Okay, thank you everyone. 15 minutes and